Dear all, Dr. Vishal from Vishwa Medical Coaching, and the week-wise schedule for our program, which is meant to upgrade the basic clinical knowledge as for the CCMP course, modern pharmacology, as well as the clinical topics in medicine, surgery, obstetric and gynecology, and pediatric. This is a recorded lectures batch as well as a classroom program in which you'll be able to learn all the basic clinical pharmacology topics as well as the obstetric and gynecology, pediatric surgery, uh, PSM, as well as the other clinical topics, so that you can upgrade your knowledge and you can also uh, will help you to practice well in your career. So the week one we are going to learn about, as you see in the picture, general pharmacology. Then we have autocoids and the NSAIDs, then ANS, autonomic nervous system pharmacology. Then we have respiratory pharmacology as well as medicine. In that, we're going to learn about the COPDs and asthmas, pneumonia, tuberculosis, pleural disorders. In the GI system pharmacology and medicine, we're going to learn about the basic gastrointestinal pathologies like GERD, peptic ulcer, treatment of vomiting, treatment of diarrheas and dysenteries. In sixth topic, we're going to learn about the cardiology topic, general cardiology topics, ischemic heart disease, angina pectoris, myocardial infarction, medicine as well as pharmac point of view. Seventh, we have hypertension medicine, the most important question in your career as well as in exams, and rheumatic heart disease and the rest of the clinicals in cardiology. Then we have renal pharmacology and the drugs acting on the RAS system. Then we have blood pharmacology and medicine. In that, we're going to learn about anemia, types of anemia, treatment of anemia, anticoagulants, thrombolytic drugs, antiplatelet drugs, etc. The nervous system pharmac, first part, we're going to learn about an anesthesia drugs, alcohol, anti-epileptic drugs, anti-Parkinsonian drugs. Then in the part 2, we're going to learn about the antipsychotics and the rest of the nervous system pharmacology. In the endocrine system, medicine, surgery, as well as the related topics in thyroid as well as pituitary gland, where we have hypothyroidism, hyperthyroidism, anteropituitary and posterior pituitary gland, hormones, and the pharmacology and medicine related to that. Then we have the most important topic called diabetes and complications. We have a complete lecture devoted to diabetes, types of diabetes, management of diabetes, treatment of diabetes, drugs for diabetes. And then we have contraceptive methods as in pharmacology as well as a gynecology topic. Then we have infections and antimicrobials. We're going to learn about, in the infections and antimicrobials, we're going to learn about the basic concept in antibacterial drugs. And then we have penicillins and cephalosporins, sulfonamides, broad spectrum antibiotics, and all of the antibacterial drugs. Then we have antiviral drugs, antiretroviral drugs, treatment of HIV, antifungal drugs, antiprotozoal drugs, anti-helminthic drugs. Then we have disease, malaria, tuberculosis, leptospirosis, typhoid, dengue, common medical infectious disorders that we're going to learn. Then we start the surgical topics like we have hernia, hydrocele, fistula, piles, fissure. And then we have cellulitis, burns, abdominal pain, scrotal pain, venisections, shock, varicose vein, varicocele, breast lump, wound healing. And then we start the basic gynecology topic like antenatal care and fetal well-being. In that we're going to learn about basic antenatal care. Then we have normal labor, devoted one complete lecture to normal labor, stages of labor and phases of labor and complications of the normal labor. Then we have puerperium and complications in the breastfeeding. Antepartum hemorrhage, in that we have placenta previa, abruptio placentae, abortions, molar pregnancies, ectopic pregnancies. Then we have postpartum hemorrhage, vomiting in pregnancy, oligo and polyhydramnios. Then one lecture will be completely devoted to PIH and eclampsias. Remember, most important topic. Then we have heart disease in pregnancy, diabetes in pregnancy, premature rupture of membranes, preterm labor, prolonged labor, twins, IUGR, intrauterine growth restrictions, intrauterine fetal death, post-dated pregnancies, inductions, HIV in pregnancy, Rh negative pregnancy. Then we have menstrual disorders, contraception, infertility. Then we have prolapse intervertebral disc. In the orthopedic topic, the surgery can be asked, as well as in gynecology we have pelvic inflammatory disease, CA ovaries, CA cervix, pap smear, prolapse of the uterus. Then we will start the basic pediatric topic called the newborn care, neonatal resuscitations, vaccinations, growth disorders, nutritional disorders, PEM, protein energy malnutrition, kwashiorkor and marasmus, basic respiratory infections. And then some of the preventive medicine. We have epidemiology, levels of prevention. Remember, we have primary, secondary, and tertiary. The method of an healthcare delivery system. And then we have the cold chain, iceberg phenomenon, national health programs, immunization programs, prevention and control of non-communicable disease like heart disease, hypertension, obesity, cancer, etc. And then we have prevention and control of communicable disease, tuberculosis, leprosy, dengue, malaria, leptospirosis, etc. And then we will start the revisions of all these topics so that we can make sure that you understand those things properly and we retain this knowledge not only for the exam purpose but also for the rest of your life so that your practice can be beautiful. Thank you very much.